Welcome to another episode of my news flash broadcasted for you at Hello Irlandia, straight from the US. I had a longer break over the last few weeks from reporting on what's going on for two reasons. First of all, our team was working on putting up our own completely independent website and creating the content. And you can find us at helloirlandia.com, and I'll put the link for you in the description below. It would be great if you guys want to check it out. We create bilingual content in English and Polish. Another reason of my absence was my summer travels to Caribbean island, specifically to Puerto Rico. I have yet to put up some holiday videos, so stay tuned for that. The Caribbean climate is definitely healing, but it ain't no paradise for a specific reason that no one wants to mention. And I'll share my thoughts on that in the following episodes. Today, I'm going to sum up the recent developments in the medical field in the US and the positive changes that the Trump administration is bringing on in regards to drug prices and the COVID vaccine. I'm also going to discuss the newest Russian achievement in the respective field called Sputnik-V, which stands for the Sputnik vaccine, or maybe it stands for Sputnik Vladimir? Who knows? And finally, the further controversies around the well-known COVID remedy recommended by POTUS, but continuously suppressed by the so-called medical establishment. I will also mention some not so well-known alternatives, and for that reason, I'm gonna need to use a bit of coding to evade a certain mathematical procedure that is automatically applied to all of the YouTube content. Of course, by coding, I don't mean it IT-wise, but more in the semantic sense. And I promise I'll make it easy. You see, censorship is coming at us from all possible angles, and while I can still air some of my content on the radio that runs as their broadband, as long as I stay out of the current heated political issues, I can't possibly have any debate with a heartless algorithm. So much for the humanity benefiting AI. Okay, but let's move on and start with POTUS's announcement slightly over a month ago on July 16 about some exciting things that his administration will be announcing over the next 8 weeks. Those are, quote, things that nobody has even contemplated, thought about, thought possible, end of quote. The projected changes will happen in regards to education, immigration, and a very complete healthcare, as well as other things that people were hopelessly tied up in knots in Congress for about 30 years in the procedural sense because they were being stalled by the previous administrations. The plan is to implement the new proposals with the help of deregulation. Quote, you'll see levels of details and you'll see levels of thought that a lot of people believed very strongly we didn't have in this country. End of quote. The president also emphasized that those changes have already been set in motion and that nobody is ever going to see 8 weeks like we're going to have. End of quote. Trump has been working on the issue of relieving Americans from the overwhelming and business-stalling regulations since he entered the Oval Office in 2017. The goal has been to remove those federal regulations, which were seriously threatening not only the commerce itself, but also the standard of living of average Americans. Those standards plummeted dramatically during the last few decades, leading to a severe impoverishment of citizens, their families, and even whole cities and regions. Many Americans found themselves in debt for life, unable to safely navigate their deteriorating financial situation. And the new regulations that kept coming under previous presidents were not helping them rid of this debt. Quite contrary, they were sinking them deeper. Those laws involved an increase in the income tax over the years and moving almost all of the production and manufacturing jobs to China and other countries. During the last 3.5 years in the White House, President Trump managed to increase the ratio of regulations being removed per every regulation added from 2 to 1 at the beginning of his term to nearly 8 to 1 in the recent months. According to the numbers mentioned by POTUS during the speech in the Rose Garden, the previous administration added 600 new federal regulations, filling over 16,000 pages, while the current administration has already removed 25,000 pages. Those hundreds of new rules costed an average American an additional $2,300 per year, not sparing those with a poverty-bordering income, including many African Americans. Trump is undoing the lingering bureaucratic obstacles put in place prior to 2017, whose main objective was to slow down any attempts in implementing innovation, that is, extending the statutory waiting time for new proposals to be introduced, and furthering the economic prosperity of the US and its citizens. Sometimes less is more. Once the obstructive laws are gone, it will be easier to enact new, exciting developments. We're going to get things done, said POTUS. The first big boom came over a week later, on July 24, when Trump signed 3 executive orders on lowering prices for patients by eliminating kickbacks to middlemen, increasing drug importation to lower prices for American patients, and access to affordable life-saving medications. POTUS is helping average Americans to cut on pharmacy spendings, making rich middlemen poorer and low-income Americans richer by rolling back regulations on who dictates the drug prices and ending the legal base for the abuse of the medical system and bribery by federal health community centers. Generic medicines will now be available for the US citizens for the equal, meaning rest of the world, prices. And the US will no longer unwillingly sponsor free drugs and healthcare in socialist countries across the world, like it was legally bound to until now by the corrupt lawmakers under previous administrations. So, in case you ever wondered how Scandinavia or Germany was able to offer such great free healthcare to their citizens and their massive waves of immigrants, now you got a painful but true answer. It was being paid for by American taxpayers, American patients, American citizens who eventually were led into poverty. But the middlemen are making a fortune, and pharmacy benefit managers and people are just bilking Medicare patients with these high drug prices while they pocket gigantic discounts. Gigantic discounts. The amount of money they have made over the decades is too incredible even to speculate or say it's massive. Some very rich people are not going to like me very much today, I can tell you. Laughter. I probably know them very well. I probably see them in Palm Beach. Laughter. But nobody ever talks about who they are, said POTUS. The 4 main executive orders will significantly lower the prices of prescription drugs, such as, but not limited to, life-saving insulin and epinephrine, that is, allergy-countering pill. This bill is aimed at easing the struggle of the poorest part of the American population, who are not covered by any kind of corporate medical insurance or federal programs such as Medicare and Medicaid. The cost of a single vial for diabetes, not covered by insurance, oscillate around $250, which corresponds to spending of $500 plus per month. And the full price of epinephrine is over $600 per kit. But the situation of the beneficiaries of the Medicare programs hasn't been much better. The generic drug prices rose by 47% between 2010 and 2015 from $175 to $257. And that topped the bare insurance policy cost. Many recipients ended up with a high debt caused by medical bills and insurance premiums. One example being $15,000. President explained that the way federally qualified health centers, or FQHC, currently operate created a situation where they diverted huge discounts, up to 50%, on medicines obtained from drug companies, from the original intended recipients, that is, patients, to themselves. Health plan sponsors and pharmacy benefit managers, or PBMs, or middlemen, as Trump simply called them, were enabled by the ruling of previous administrations and fortified themselves further by introducing very detailed reform-proof regulations. In consequence, some lawmakers tried passing new laws for over 25 years and still wouldn't see them being implemented. Meantime, the PBMs were profiting off of the rigged meds distribution system and collecting large sums of money from patients, the people whom they swore to serve. Understandably, the sole work of the middlemen is to make profit, and they don't contribute at any step of the production or the distribution process. On top, certain legislations banned pharmacists from advising patients on the most competitive drugs and drug alternative prices. POTUS pointed out the corrupt behavior of those state entities and called the income acquired from the pharmacy shoppers under the aegis of the long-enforced laws a bribe. Quote, "These rebates are the functional equivalent of kickbacks and erode savings that could otherwise go to the Medicare patients taking those drugs. Yet currently, federal regulations create a safe harbor for such discounts and preclude treating them as kickbacks under the law." End of quote. Trump announced an end to this corrupt behavior and signed an order that will prevent such unlawful deals from taking place in the future. From now on, all the discounts negotiated by the middlemen will benefit the patients. The Medicare recipients will be able to purchase insulin for up to $35 per month, and the prices for uninsured and those with high unmet deductible will be lowered to the level of the pricing for middlemen. More low-cost health insurance plans are being introduced simultaneously. Another issue on the agenda was the inability of the US to negotiate the drug prices for purchase from foreign manufacturers. Americans were restricted by their own Congress in these regards. It was actually made illegal. The cost of producing drugs is extremely high due to long approval awaiting time, etc. The brokers and intermediaries bulge the prices even higher, and those eventually break an average Joe. POTUS's executive order will allow the import of the same medicines, but at a cheaper price, from Canada and other countries, and make it available to American patients for the value lower by 30 to 90%. This is the amount paid by other more or less developed countries. The reason the US paid such high costs until now was the fact that it was obligated to pay the full production cost, including the research and development of those drugs. The other developed nations not only weren't contributing their fair share, on the contrary, they were reaping the benefits by distributing cheap drugs paid from the pocket of an American taxpayer among their population. Trump tagged it as global freeloading on the backs of American patients and American seniors, perpetrated by countries like Canada and Germany, and explained that, quote, "The US taxpayers are effectively subsidizing the socialist healthcare system of foreign welfare states and many other countries. We will end that abuse and restore the principles of free enterprise." End of quote. The last order signed is called Favor Nations. And I don't think I have to explain that the name is purely sarcastic. And it is being postponed until August 24th as a courtesy towards pharmaceutical companies, which are given a chance to offer some significant drops for medicines costs. If they don't show any initiative, the US will automatically enact the above-mentioned law and start paying the amount equal to any other economically advanced country. Trump also reminded the Right to Try bill, which is underway, and which makes possible for terminally ill people to try a drug that hasn't been approved for the specific condition yet. It takes about 3 years under current regulations to fulfill the safety standards for testing, but which shows a promise of being effective because it has already been authorized for use for corresponding diseases. The pharmaceutical industry was not in favor of this one, even though the alternative for the patient was death, and thus had been successfully blocking it for 42 years. Hydroxychloroquine, also known as HCQ, has been proposed by the Trump administration as a treatment for coronavirus. And it comes, as I said, with zinc and azithromycin, known under the brand names as Zithromax or Z-Pak. Another drug highly praised by POTUS as an effective COVID cure and included in the Right to Try program is remdesivir. The president and his team have worked on medical reform from the beginning of their tenure. As a result, in 2018, Medicare premiums for prescription drugs have been cut by $1.9 billion, and lowering the cost of generic drug prices reduced the medical expenses of the US patients by $26 billion. On August 11, when President Trump was giving a briefing on the progress with quite a few vaccines being developed by the American scientific community in their record time, which by then entered phase 3 of extensive testing on the eastern side of the globe, President Vladimir Putin announced that he already has the first COVID vaccine ready and approved by the Russian Ministry of Health. The vaccine was named Sputnik-V, which perhaps suggests that Russia was in a hurry to release it, after only 2 months of human testing. The antidote hasn't even entered phase 3, during which it is given to a large group of people, dozens of thousands, in order to determine whether it is safe for the general population and whether the test results are better than the placebo probe. The most important indicator of those trials is the mortality rate in people who received the injection. Vaccines are given to the healthy part of the population, so their standards must be very high, which is not always the case. Shockingly, Putin revealed that he had administered a dose of the newly manufactured vaccine to one of his daughters, but he did not specify to which one, and that she felt alright after, even though her initial reaction was a slightly elevated temperature. The new formula is claimed to have been based on the harmless strains of coronaviruses, which usually cause a cold. Apart from the president's daughter, a dozen other people received the injection, including part of the military and several scientists from the Gamaleya Research Institute of Epidemiology and Microbiology, who worked on the vaccine. In all honesty, not everyone in Russia unanimously celebrated Putin's success. Some health organizations have expressed deep concerns about the safety of the population to be injected and have made official calls to delay the vaccine from entering the market until it has passed all required testing phases. WHO has already got in contact with the Russian health authorities, but so far it maintains the official narrative to only allow vaccines that have passed unified standards of quality, safety, and efficacy. The Russian Ministry of Health plans to launch the vaccine on the market on January 1st, 2021. The inoculation should ensure immunity to the coronavirus for a maximum period of 2 years. Putin stressed that the shot will not be compulsory. He plans to launch the vaccination program in parallel with phase 3 of testing, which may or may not provoke a conflict with the World Health Organization. The current number of projects engaged in developing an effective COVID vaccine is approximately 150 worldwide. 25 of them have already entered the clinical phase. Sputnik-V is to be produced in an initial number of 500 million doses under the international agreements. 20 other countries have already ordered another billion. Critical comments regarding the whole enterprise were made, among others, by the United States. The Secretary of Department of Health and Human Services, Alex Azar, said, quote, "The point is not to be first with a vaccine. The point is to have a vaccine that is safe and effective for the American people and the people of the world." End of quote. He explained that Russians did not disclose the data from the initial testing stages and that their actions lacked transparency. A similar opinion was expressed by none other than the infamous Dr. Fauci, who said he doubted that Moscow had compelling evidence that its antidote was safe because it had rushed too much. The international voices, at least those heard in the mainstream media, also uttered doubts about the reliability of the entire undertaking. Azar added that the vaccine prototype must pass phase 3 of testing in order to be backed up with data that shows that the vaccine is safe and effective, and that's what President Trump is leading with Operation Warp Speed. 6 vaccines are currently being tested as part of the program, and 3 of them have already entered phase 3, including the Moderna project, which started in March and successfully completed the previous phases in just 5 months. At this rate, 100 million gold standard doses are expected to be produced by December this year. The government will pay the vaccine manufacturer $1.5 billion, but patients will get their dose free of charge. Regarding the Russian vaccine, Matthew Schmidt, a Russia expert at New Haven University, predicts cheating on the scientific process hurts the perception of vaccine safety everywhere. The fears that it's unsafe could even stoke the anti-vaccine movement and drive up the number of people who refuse to be inoculated because it will feed conspiracy theories in the US and elsewhere. Hopefully, that will be the case. President Trump so far expressed hope that the Putin's vaccine is good, but he said he hasn't looked into it yet. Instead, he gave an extensive update on the national progress with regards to vaccines being produced in the US. In May 2020, President Trump, in partnership with the scientific community and the private sector, launched Operation Warp Speed to deliver a safe and effective vaccine, point-of-care rapid tests, and therapeutics for COVID-19 as soon as possible. Companies that were selected for the investment of $12 billion towards an accelerated development of the immunization project include, among others, Moderna, Sanofi, GlaxoSmithKline, and Johnson & Johnson. As 3 of the vaccine candidates have already entered phase 3 of clinical trials, that is AstraZeneca, Moderna, and Pfizer, the administration is planning to begin their manufacturing correspondingly. National Institute of Health, or NIH, will facilitate enrolling individuals into the clinical trials. The US aims to produce 600 million doses, which will be affordable or even free to the American public. They are promised to arrive by the end of the year. The vaccine, however, will not be mandatory. Trump emphasized it many times during his press conferences, stating that there are many potential cures for COVID, which can be used instead. Those drugs or therapies are currently trying to find their way to those who need them. But like in the case of hydroxychloroquine, they have to first combat the restrictions regulating the process of approving medicines for the wider public. The president has already cut down on a lot of those across all industries, so the anticipated alternatives are en route to their hopeful recipients. The Food and Drug Administration has recently permitted over 200 coronavirus tests, including about 170 molecular, circa 40 antibody and 2 antigen tests. But following the president's steps, the vaccine isn't the only remedy they consider. FDA launched coronavirus treatment acceleration program that offers a vast range of new treatments. POTUS hasn't elaborated on the character of the therapeutics, which are currently undergoing an intense trial stage, but there are over 140 of them. The most mentioned examples of the known therapies in use are remdesivir and dexamethasone. As for the new therapies, the one often mentioned is the possibility to use blood plasma coming from people whose immune system defeated the virus. Their antibodies may prove useful in combating COVID, especially for people with immunodeficiencies. Mayo Clinic have conducted studies showing that convalescent plasma is safe and positively impacts the recovery process when administered early on. It can also be used for creating hyperimmune globulin, which is currently being clinically tested. The President encourages everybody who recovered from the virus to donate their plasma. Another promising remedy is Regeneron's double antibody cocktail. During a surprise press conference in front of the White House on July 29, Trump said, "I love the idea of therapeutics. When you go in, you give somebody a transfusion or a shot and they get better. I am a big therapeutic person, but we're doing well on vaccines and therapeutics." Minutes earlier, he was asked by a journalist to comment on Stella Immanuel, one of the America's frontline doctors, who on July 27th publicly presented many testimonies in front of the Capitol Hill in DC on the 100% effectiveness and harmlessness of hydroxychloroquine when used for treating coronavirus patients. POTUS answered that although he had never seen her before, he was very impressed with her because he thought she made sense. He remembered that she's had tremendous success with hundreds of different patients using hydroxychloroquine. According to the Nigerian doctor herself, she treated over 350 patients with HCQ and all of them recovered. Dr. Emmanuel, Trump continued, was accompanied by the other very respected doctors who claimed to have been having similar results, and they all should definitely have a platform, but their voices were silenced just like the voices of all conservatives. Concluding the HCQ topic, Trump added, "All I want to do is save lives. I don't care if it's hydroxy or anything else. All I want to do is save lives. If we can save lives, that's great. That's great. I happen to be a believer in hydroxy. I used it. I had no problem. I happen to be a believer. Many people agree with me. A great test just came out of the Ford Clinic in Michigan. Very respected. We'll see how it is." End of quote. Meanwhile, Dr. Emmanuel grew to the level of hydroxychloroquine celebrity among those convinced about its virtue, and became a vaccine and mask-bashing quack to the never-questioned the mainstream narrative zealots following the tech giants and the fake news truths. As a result of strong voices validating HCQ, which has been widely used for other commonly known diseases like malaria and lupus, a petition to the White House was drafted, requesting an executive order which would authorize the use of hydroxychloroquine as prophylaxis for COVID. Before that happens, Dr. Stella and her brave colleagues have already taken matters in their own hands. "We have networked with doctors in all states accepted that are not afraid to see patients," she writes in another tweet. "Keep your family safe. Need to see one of our doctors nationwide? Visit frontlinemds.com. But how can the US entertain not only the idea of heading the research in the vaccine field, but also to be promising innovative remedies for the China plague, when only 10% of the active pharmaceutical ingredients constituting generic drugs prescribed in the US 9 out of 10 times are being produced in the country? China and India are the biggest US suppliers of those, controlling over 50% of the shipments. as Trump's one of the most important points of focus for the US since his first election rallies has always been bringing back the great American economy and American jobs. He now used the Defense Production Act, signed in the 1950s, to provide a $765 million loan for the Kodak company, based in Rochester, New York, to facilitate the transformation from the analog photography industry, of which they were pushed out after they didn't follow the global digital trend, to the leading US manufacturer of the key medical supplies. Kodak Pharmaceuticals will be producing up to 25% of all active ingredients for generic drugs. A similar deal happened with the Fujifilm Texas NAM Innovation Center, which will receive another $265 million of the federal spendings to effectuate the biomanufacturing process for the Novavax vaccine, which is one of the few advanced stage vaccines that has positioned itself ahead in the race to combat the China virus, called Operation Warp Speed. This way, Trump is securing critical supply chains and medical manufacturing in the US, just in time, because it has become extremely difficult nowadays to get a bottle of hydrogen peroxide at a pharmacy. The shelves with disinfectants are being emptied at any store carrying them in a record time within a 20-mile radius. And the same goes for the internet sellers. This is an excellent demonstration of how reckless it had been on the part of the previous administrations to have allowed almost all of the national manufacturing to be disenfranchised and replaced with cheap Chinese outputs. Not to mention outsourcing of customer service centers to India and other countries, which pitfalls deserve a separate entry. It is literally a matter of national security to get independent from the communist China's commodity production, especially in the field of vital supplies like pharmaceutical drugs, ingredients. First and foremost, China's purity standards have been questioned for a long time. Why then rely on the economic competitors and the political rivals' merchandise and promises? Seems like a very unhealthy choice to make. Unless the US administration can have a significant level of insight into the foreign suppliers' production processes and business relations, which is what the American officials are currently providing by making new deals with China and other countries to fulfill the remaining 75% of the domestic pharmaceutical market needs under the conditions satisfactory for the US and perhaps only as long as it's necessary. The US is also globally leading in testing for the coronavirus and, ironically, in the number of detected cases of COVID, but that is a logical implication of the increased testing. So far, the country conducted around 55 million tests, which is double the number of tests performed in Europe. This, coupled with the executive order number 13939, on discounts on prescription drug prices, banning kickbacks to the middlemen within the pharmaceutical industry, and severely restricting lobbying, Executive Order number 13770 from January 28, 2017, sets the US on the fast track to improving not only its healthcare system, but also fine-tuning its economic recovery after the Chinese virus low blow. Higher standards of living are largely defined by the economic success, but the population's prosperity depends just as much on the simple facts of life, like good health and political sovereignty. As per the controversial side of the corona treatment options, the Bolivian government approved a certain chemical substance made of 2 atoms of oxygen and of 1 atom of chlorine as a cure for COVID, which can be purchased right at the pharmacy. The first one to report it on Twitter was Jordan Sather, who conveyed this message on July 15th from a German biophysicist, Andreas Kalker. Kalker specializes in researching this and other potential paths of treatment for all sorts of diseases. Both Kalker and Sather have been heavily censored by social media for the very reason of talking about alternatives to conventional pharmaceuticals, and sometimes also lack thereof. About a week later, Reuters confirmed the story, and so did all the major news outlets, but not a day sooner than they had to. Reuters clarified that the substance was approved for medical use by the Senate, despite the Ministry of Health's contrary stance. Also, pharmacy customers seem to like it a lot. And the last issue for today isn't the good news, unfortunately. America Out Loud reports that on August 10, the FDA denied the Emergency Use Authorization, or EUA, for widely known malaria medicine, hydroxychloroquine, for outpatient preventive and early treatment of COVID. The person responsible is the FDA Commissioner, Dr. Stephen Hahn, who abides by the claim that HCQ has been harmful to patients in advanced stages of sickness. This is in stark contrast with the fact that HCQ has been approved by the FDA since the 1950s, and for a variety of diseases, beginning with malaria and lupus. Apparently, it's been one of the safest drugs on the market because it showed undeniable effectiveness with not only young and elderly patients across all ethnicities, but even with pregnant women and nursing mothers. The latest clinical trials have been run by Dr. McKinnon from the Henry Ford Hospital, and also by an independent physician from upstate New York, Dr. Vladimir Zelenko, whose success with treating patients with coronavirus with the combo of HCQ, Z-Pak, and zinc I already mentioned here a few months ago. Dr. McKinnon's test concluded that urgency is a critical factor when it comes to administering HCQ to the infected with the coronavirus, and 51% of deaths were avoided if HCQ was given to patients within 24 hours of their admission to hospital. After arriving at those conclusions, Henry Ford researchers filed a request for another round of emergency approval of HCQ and hoping for the upcoming right to try bill to be respected. Both Dr. Hahn and Dr. Fauci, who had held a position at NIH back then, had known about the effectiveness of chloroquine, or CQ, for SARS-CoV-1, which is closely related to SARS-CoV-2, also known as COVID-19. About 80% of their genomes are the same. Since at least 2005, when the epidemic of the first type broke out in China, because the NIH and the CDC had conducted studies on chloroquine and hydroxychloroquine at that time. Interestingly, on May 1st, 2020, the FDA approved remdesivir for emergency use with COVID, even though the medicine hasn't been tested extensively. Quoting America Out Loud, remdesivir showed very little benefit shown in hospitalized COVID patients and had serious side effects. Of course, it helped that 9 of the experts on the NIH panel were supported financially by Gilead Sciences, maker of remdesivir. Dr. Peter McCullough and his cardiology team at Baylor Heart and Vascular Institute in Dallas emphasized not only the staggering benefits of using HCQ in early stages of COVID, but also the importance of it in prophylaxis. It shows that HCQ was given not only to frontline medical workers, but also to law enforcement officers, teachers, factory workers, clergy, truck drivers, flight attendants, and many, many others. Even POTUS admitted he has been taking it as a prevention, and he feels great. If HCQ is so effective, what problem does Hahn and Fauci have with it? Well, the HCQ azithromycin or doxycycline and zinc supplement combo pill treatment costs $30 per course of 5-7 days, while above-mentioned remdesivir, not half as safe as hydroxychloroquine, has to be administered intravenously in hospital, which charges the patient a whopping $3,500. And there is no significant data showing that it actually reduces deaths. The agenda behind those latest decisions coming from the FDA is more than obvious. It's pure business and zero care. In America Out Loud's own words, Americans are dying needlessly for political and financial agendas, not due to lack of available treatment for COVID-19. We cannot afford more preventable deaths, waiting for some magic bullet of a, let me just say it in French, vaccin. Even if we have a vaccin, that works, and even if it is actually safe, we still need therapeutics such as HCQ. HCQ dispensing must not be limited to persons with a positive test. Such limits also prevent prophylactic use. Governors and other officials must not be allowed to arbitrarily restrict life-saving HCQ treatment. Frontline doctors and patients' advocacy groups have been pleading with the FDA and state officials since March to open access to early treatment with HCQ. The supply of HCQ has been ramped up to handle its use in early treatment of COVID. The strategic national stockpile has millions of doses deteriorating in government warehouses that are not being distributed because doctors are prevented from prescribing for outpatients with COVID-19. End of quote. The news outlet further calls holding Dr. Han accountable for the deaths that could have been easily prevented with the safe, cheap, and effective HCQ. After all Americans should have their medical freedom and be able to decide their treatment without government interference. And this is exactly what Dr. Stella Immanuel, one of the fierce HCQ propagators from the Capitol Hill press conference, censored by all the big tech, calls for, just in a wee bit more descriptive way, namely, quote, "It's time to come out on the streets, America. We can't just allow these creatures to keep killing us. Share widely." End of quote. The Epoch Times now reports that literally days after HCQ was denied by the FDA, Representative Louis Gohmert, Republican from Texas, came out in support of hydroxychloroquine after he had tested positive for coronavirus and was subject to the combo treatment HCQ, Z-Pak, and zinc, plus vitamin D3 and C. It went really well, and now at the age of 66, he managed to produce antibodies for the Chinese virus and decided to donate his plasma, following the president's general recommendations. The battle for the legitimacy of the drug obviously continues, especially that at some point it has really become more of a political than a medical issue. That is, since Donald Trump voiced his strong recommendation for the cure, as well as a business issue. But that's just how it's always been with the medical system per se. Like POTUS said it himself, some rich men will not be liking him much now after he cut off the source of their corrupt income. And by corrupt, I mean bribery, lobbying, etc. Even though at the time that income was considered lawful. Seems like the big Parma retaliates. And while the US remains largely closed and businesses suffer, China, the pandemic originator, looks like a lot of fun. Check out this clip. The second one is a longer version and it reveals some interesting body language and onstage puppet mastery. So let's see how this fight ends. Patriots versus circle jerks, parasitic gaslighters, meritless sycophants living a wet dream of world domination. Tuning out for now.